Hi, thank you for joining our e-poster. My name is Shayna Petersell. I am a second-year medical student from Rowan University School of Osteopathic Medicine. I'm going to be presenting our poster today titled Understanding the Patient Population of a Student-Run Free Clinic, a Retrospective Chart Review. So to give some background about our clinic, the Camden Community Health Center, which I'll be referring to as CCHC, was established in Camden, New Jersey in 1999 and remained open until 2018. CCHC was a student-run clinic that provided cost-free, non-emergent primary care services and provided care for over 2,000 patients. We provided various services, including annual physical exams, chronic condition management, sick visits, referral to specialty care, and much more. Patients were not asked about various factors regarding income, insurance, or legal status, which made CCHC an accessible source of healthcare for the community. During a typical clinic visit, each patient would usually be seen first by an upper-level medical student, so a third or fourth year, along with a lower-level student, a first or second year, to perform an initial history and physical. Students would then report to the resident and attending present that day and would see the patient afterwards to addend and approve the final assessment and plan. A new iteration of the clinic with the same mission, Rowan Community Health Center, also known as RCHC, opened in 2019 and is located in Lindenwold, New Jersey. The main goals of this project are to quantify the common healthcare needs of CCHC patrons, to compare clinic demographics to that of Camden, New Jersey proper, to assess quality of care at CCHC, as well as outline potential improvements for RCHC. So for methods, the Rowan SOM Institutional Review Board gave our study IRB approval prior to beginning the study, and we also received permission from RCHC to use the patient charts. Our retrospective chart review consisted of 1,182 individuals with 1,552 visits from patients who received care at CCHC from 2000 to 2018. Paper charts were randomly selected from the clinic chart archive, and once a paper chart was selected, we input all the data from a chart into a form on a database called Qualtrics. The form consisted of questions asking demographic information, including name, date of birth, town of residence, race, primary language, along with various social history questions. And then we also asked medical history questions, including pre-existing conditions, chief complaint, vaccination history, treatment, plan, referral, diagnosis, and more. The data was then transcribed into a spreadsheet and analyzed using Excel. Any charts without pertinent data like age, gender, race, chief complaint were excluded from the analysis. All relevant categorical variables were described as percentages, while means were calculated for continuous variables. So moving on to results. So within our study, we randomly extracted data from our patient charts to see trends in both our patient population demographics and for common medical issues and information. We saw that the average age of our patients was about 33 years old, and we saw a large range of patients from 1 to 80 years old. Our biggest demographic was seen in 18 to 40-year-old adults, which represented 44% of the patient population. 24% were children under 18 years old, and 31% were above 40 years old. One of the most surprising findings we saw were that only 6% of patients had listed a prior relationship with a PCP on their intake form. This may have not been asked to every single patient during their visit, but this is still a very low and significant finding. While most patients only came to CCHC for one visit, we saw that only 14% of patients came for a subsequent visit after. 66% of patients also resided in Camden, while 34% resided in surrounding areas like Pennsauken, Cherry Hill, Sicklerville, and even outside of New Jersey, so from various states like New York, Delaware, Virginia, Georgia, and more. Moving to the bottom half with medical history, 68% of visits had a chief complaint for school and work physicals, along with well-child visits. Next, out of the 1,182 patients, only 501 patients had listed a prior medical conditions. The most common pre-existing conditions that we saw throughout our patient population were hypertension, asthma, cardiovascular disease, and diabetes. 30% of our patients had a new diagnosis at their first initial visit, ranging from dermatologic and cardiac being the most prevalent with 18% both each. Lastly, regarding treatment, 23% of patients were given a prescription with their visit, and 42% of patients had labs ordered. Lastly, for conclusions, the rates for most of the common conditions in the clinic population were comparable to the county data, but we did see that primary care physicians have a great need for, especially within South Jersey. 6% of patients had listed a prior PCP, which demonstrates further need to investigate if and why patients don't have access to a PCP. CCHC had a large percentage and role in providing required work in school physicals. One could extrapolate that those who visited CCHC for required physicals likely did not have a PCP and or did not visit them regularly. Some of the patients traveled over 100 miles and crossed state borders to be seen at the clinic. 86% of those patients who came for physicals did not make subsequent appointments, further suggesting that these individuals likely do not visit a physician regularly or cannot afford to do so. Some limitations we ran into and areas for improvement is within the consistency in intake forms. Due to inconsistent paper SOAP forms over the years, there was an inconsistent medical information collection. In responses, RCHC, the new clinic, has implemented EMR, electronic medical records, and tailored our intake forms for consistency from patient to patient. And lastly, there's a need for accessible and affordable primary care in the South Jersey area, which RCHC strives towards filling this gap. I would just like to thank Rowan University, as well as all the faculty who helped us with our clinic. I'd also like to thank Sobiah, Ashley, Shelley, Roma, Isabel, as well as our PI, Dr. Gupta, for helping me in this project. Thank you so much and have a great day.